Good afternoon, everyone, and thank you for joining the session on the impacts of COVID-19 on 2S LGBTQIA+ populations. My name is Beth Jackson, and I'm Senior Science Advisor in the Social Determinants of Health Division in the Centre for Chronic Disease Prevention and Health Equity at the Public Health Agency of Canada. I'm joined today by three impressive panelists: Faye Johnstone, Genevieve Culverson, and Nathan Lachowski, who I'll introduce in more detail in a moment. The purpose of today's panel, as the title suggests, is to discuss the impacts of COVID-19 on 2S LGBTQ+ communities. We'll approach this topic in a discussion format, no formal presentations today, and we'll focus on three questions or themes. First, why talk about LGBTQ populations and COVID-19 at all? How are these populations affected, both directly in terms of conditions that may put them at risk for contracting COVID or suffering poorer outcomes, and also in terms of the impact of social distancing measures and related societal effects of the pandemic? Second question is, how can we undertake meaningful engagement and ethical research and collaborative action to address these inequitable conditions and outcomes? And then finally, some thinking forward about where do we go from here? What can we learn from the creative responses of our communities in this context? And what can we do to strengthen the resilience of these communities going forward? But first, I'd like to pay tribute to the Indigenous peoples upon whose traditional lands we do our work. I'm originally from Treaty 1 and Treaty 2 territories, the traditional unceded territories of the Ojibwe, Anishinaabe, Inuktitut, and Cree and Dakota peoples. Treaty 1 territory includes the Red River Settlement, now Winnipeg, the birthplace of the Métis Nation. I now live and work in Ottawa on the traditional unceded territory of the Algonquin Anishinaabe people, and it's a privilege to work, live, and learn on these lands. We all acknowledge that our communities have benefited in the past and continue to benefit from the historical relationships and treaties with Indigenous peoples and nations. And our labors here are undertaken in the spirit of reconciliation. We humbly work to establish and maintain mutually respectful relationships among Indigenous and non-Indigenous peoples, to build trust, enable healing, and create a more equitable and inclusive society. In this context, and in the context of our topic today, it's important to recognize that the acronyms we'll be using, LGBTQ2, for example, is the construct, a colonial construct in itself, and that once revered identities such as Two-Spirit were deemed sinful and were largely erased by European settlers. So today we aim to resist and expose the harms of the heterosexist and cissexist, I always stumble over that one, systems that settlers brought here and that continue to thrive today. We're also here to celebrate sexual and gender diversity and the resilience of 2S LGBTQIA2+ Canadians and people in the face of substantial barriers to their well-being. So one more thing before I introduce our panelists, and then I will definitely be handing the show over to them. But while today's session will presume that you have a basic understanding of concepts and issues related to sexual orientation and gender identity, I'm going to take a moment to unpack that acronym in today's session's title, 2S LGBTQIA+. These acronyms that we use, because these are plural, are constantly evolving. And there are several variations that are in use inside and outside of our communities. Some of you may recall when the G was at the front of the acronym, those of you with as much gray hair as I have, at least. And that was one of the first well-established, well-known sort of sets of acronyms, GLBT. But as women's voices became stronger in these communities, and as gay men became more aware of sexism and feminism, and as lesbian and bi women gained recognition for providing substantial support to their gay brothers and trans sisters during the HIV/AIDS crisis of the 80s and 90s, the L was moved to the front of the acronym as a signal of respect and solidarity. And we're seeing a similar shift now in profiling 2S or two-spirit at the front of the acronym. This is a sign of solidarity and a gesture of reconciliation as our communities come to grips with the impact of colonization and on two-spirit and indigenous people. It also reflects our growing understanding that sexual orientation and gender identity and expression are complex, exist on a spectrum, and are fluid and culturally specific. Our understanding has also evolved towards empowerment, allowing and encouraging individuals to identify themselves and acknowledging that, again, these identities are fluid. So accordingly, the acronym has expanded to include letters like Q for questioning or queer, depending on who you're speaking with. A for asexual, for people who have no or experience a low level of sexual attraction and desire. I for intersex, terms for someone whose biological sex characteristics do not align with traditionally understood male and female bodies. And as I've already mentioned, 2S or two for two-spirit, people who identify as having both masculine and feminine spirits and are used by some Indigenous people to describe their sexual, gender, and spiritual identities. The plus represents all other gender identities and sexual orientations on or outside the spectrums. So while this evolution and variation in the acronym may be confusing to some, and sometimes me included, its expansion reflects an effort to promote inclusion and recognize the diverse communities within 2S LGBTQIA+. And finally, this is also about empowering our communities, giving our communities the option to, again, define themselves, to reclaim terms that at some points may have been derogatory or painful. So with setting that stage, and thank you for your patience, I'd like to quickly introduce our three panelists. First, Faye Johnstone, who uses the acronyms she and they. She is a master's of social work practitioner. She is a trans feminine activist, public speaker, consultant, educator, community organizer, and the executive director of Wisdom to Action, with over 8 years of local and national involvement in 2S LGBTQ feminist and anti-gender-based violence advocacy. At Wisdom to Action, she leads a diverse team undertaking local, provincial, and national initiatives in the area of 2S LGBTQ+ inclusion, mental health, and violence prevention. Faye's work is driven by her passion for change and an approach informed by intersectional anti-oppression, structural social work, and lived experience. Welcome, Faye. Geneviève Culverson, I'm going to just mess up everybody's last names. Geneviève Culverson, pronouns she and her. Geneviève is a proud queer lawyer from Ottawa and the chairperson of the board of directors of Capital Pride. His mission is to create opportunities to celebrate, advocate, educate, and connect people, respecting the full diversity of the 2S LGBTQ+ community. She was called to the bar in Ontario in 2016, so she is our resident lawyer on the panel, received her JD from the University of Ottawa in 2015, and since has worked at numerous legal clinics, profit organizations, and programs where she's built her expertise in a range of areas, at present focusing on constitutional law and charter rights. She's passionate about utilizing policy, law, and the court system as a means to address structural inequities and oppression, protect human rights, and advance social justice. And she is the proud mom of 4 fur babies. Nathan Lachowski, pronouns he and him. Nathan is a gay, queer, cisgender man who grew up on a farm in rural Ontario and now works with various community organizations to advance health equity for 2S LGBTQ+ people. He's a member of the Two-Spirit Dry Lab, Turtle Island's first research group exclusively focused on Two-Spirit peoples, communities, and/or experiences. And This lab is a collaboration of Indigenous and settler researchers and community leaders who are engaged in research at the intersections of indigeneity, sex, gender, sexual orientation, and geography. Nathan is also the research director for the Community-Based Research Center, which promotes the health of people of diverse sexualities and genders through research and intervention development. Welcome, Nathan. So after that long introduction, again, welcome all of you. And just to keep the conversation free-flowing here, I'm going to put the first question out to the panel as a whole, and I will try to moderate accordingly, watching for hands or gestures to give me a signal about who'd like to go first. But the first question, just to remind you, is why talk about 2S LGBTQIA+ communities in the context of COVID? In other words, what does being queer have to do with COVID-19? How are our communities directly and indirectly affected, not only by the medical aspects of COVID, but also the social aspects? Let's start there, and then there's a few questions I think that we can use to jump off from there. Who would like to go first?
I'll jump in because no one ever knows who is the right person to go first in these moments. But hello, and thank you so much, Beth, for hosting us today. And thank you everyone for having us here to chat with you on this important topic. I think to explore the disproportionate impact of COVID on our communities, I'd like to start by recognizing the struggles that our communities faced pre-pandemic. I think a lot of folks have an impression of 2S LGBTQ communities as thriving. We passed marriage equality in 2005, and the world just got really nice and gay. We passed trans rights in 2017, and suddenly transphobia disappeared. We know neither of those things are the case. And so going into the pandemic, we already had, higher rates of homelessness, higher rates of poverty, particularly in trans communities and particularly in racialized queer and trans communities. We had, services that have been trying to meet needs in community that haven't had the resourcing to do so. And we can see that when you look at the lived realities of queer and trans folks. Experiences of isolation, being cut off from family support networks, those are things that many queer and trans folks continue to face. And that means that going into a pandemic, it's harder to survive and cope through a pandemic if you don't have a social support system, if you don't have family able to back you up, if you've been denied a job because of your gender or sexuality, or have a harder time making ends meet because of systemic income inequity. And then also know that maybe if you go see your doctor, he won't have any idea how to support you based off your queer or trans identity. And so even, reaching out for support in this world is often complicated. So I think I'll leave it there as setting a bit of the stage for why inequity operated pre-COVID, and I'll leave it to the other folks to dive in a bit more.
Sure, great. Go ahead, Genevieve.
Yeah, I'm happy to jump in. I wholeheartedly agree with everything that Faye has said, and so I completely. And what I will add is that when we think about pandemic recovery in any sense of the word, right, whether it's in terms of health, whether it's in terms of the economy, whether it's in terms of, policy and social change, we have to think about the folks who are most marginalized and who are most impacted. As Faye has said, queer folks, 2S LGBTQ folks, have faced a number of inequities for a long time. And so those things didn't happen because of COVID, but they were certainly heightened because of COVID. And so when we think about how we move forward post-COVID or during and post-COVID, we certainly have to look at how does this impact 2S LGBTQ folks specifically, just as we have to look at how does this impact racialized folks specifically, how does this impact women specifically, right? So it's not about necessarily 2S LGBTQ being the be all and end all of COVID research and whatnot, but it's about looking at the whole of the recovery and the whole of kind of during and post-pandemic worlds with a specific lens on marginalized communities. And frankly, as Faye has said, gay marriage and trans rights did not eliminate the need for all of the movement that we have behind us. So yeah, 2S LGBTQ plus folks are still one of those communities that needs to be considered with a particular emphasis on the ways in which we're disproportionately impacted.
And if I can, yeah, thanks. Thanks, Faye. Thanks, Genevieve. I certainly agree with all of those points. I think one of the other things to also, Beth, thank you for your introduction and acknowledgement of territory. For me, one of the things around this is also the fact that colonization, historically and ongoing, has functionally worked to stamp out, erase, and invisibilize our communities. And so part of the work of this is also in terms of thinking about how we can contribute to reconciliation. So I think that's a really important part to Genevieve's point. I really like that sense that it's not just about this and everything else. It really is about all of those ways in which the different parts of our society overlap. And functionally, as 2S LGBTQ folks, we live in all communities across the country. And to Faye's comments, we have unique experiences in terms of discrimination that continue, as well as healthcare access and needs. And so, I mean, some very simple examples from the epidemic during the COVID and control measures for COVID caused was delay and cancellation of gender affirming surgeries, closure and reduced capacity in sexual health services. And these are things that we know already had persistent health inequities in our communities prior to COVID coming in place. And so those are just some examples of how we are uniquely impacted as a community. And I think the other piece, as someone who has grown up and trained largely in the HIV movement, I'd be sad not to mention the fact that our community has lived through and continues to live through during the HIV epidemic. And Beth, again, thank you for your words for that in the opening. So we have a lot of experience living through epidemics, and I think in this particular kind of part of the COVID epidemic, thinking about what does it mean to live with risk? What does it mean to have lost people? What does it mean to be in the place that we're in, where I think a lot of Canadians are facing this kind of question in terms of COVID and their vaccination status and the booster status and vaccine status of other people and during the differing control measures that are in place across the country. So I think we have something there to offer as well to a broader conversation in our society.
Well, Nathan, you just made my brain explode with about 40 more questions with that comment. And thank you, Faye and Genevieve as well for your comments. And so I'm going to try to park one of those questions, which is about, the connections between the HIV/AIDS pandemic, which is ongoing, and the COVID pandemic, and just how our communities have been making sense of that, I think, in some ways, but have also been affected by it, in the sense that we have some generations in our communities that were quite badly traumatized. Obviously, we lost many people, and so there's sort of a double-edged sword there. I think I'm going to park that briefly because I want to go back to just some of when we're talking about impact of COVID. I think that there may be a bit of I don't know, misunderstanding or a lack of knowledge about even some of the medical risks, if you will, for our communities. And it's been a little bit hard to track that because COVID case reports do not include sexual orientation as a factor in the documentation. So it's a little bit hard for us to track, but we do know that there are medical conditions that are prevalent in our communities, more prevalent in our communities than in the general population, like cardiovascular diseases, like some cancers, like respiratory diseases, like asthma, and of course, HIV and other STBBIs. So can any of you comment on just sort of those foundational medical conditions that put our communities at risk? And then, of course, these are tied to some of the things that you spoke about in the opening around essentially social determinants of health and those structural inequities. I'm going to toss it back to you with that one. Any takers? Nathan, I'm gonna pick on you because you work in health specifically. So
I think Beth, you pointed out a number of pieces there that are some of those direct examples of, and I think the way Faye framed this is the things that were already inequitable before COVID started, which means that we can hypothesize that Do you know what I mean? Members of our community would be more likely to get COVID because they have those underlying preconditions that facilitate a worser disease burden in terms of if someone acquired COVID. And then potentially, during thinking about some of the socioeconomic pieces, they might have had greater exposure to COVID because of the kinds of labor that folks in our communities do. And so I think that one of the pieces that has been really challenging about that as a researcher is the lack of data. And I think this goes back to my point around colonialism, which is, I mean, sexual orientation is still not captured in our census. And so we often talk about that as a key demographic factor. Many researchers might capture that, but it's not even a part of our most central federal data set. And there are examples in various federal surveys, and there's examples in provincial and other work that will capture some of that information. But we do really suffer from quite a data gap. And so while I think our communities do a really good job of standing up and being heard and shouting back, it doesn't mean that we always are easy to be able to back up some of those really rich personal narratives of impact with the data that sometimes can speak better to policymakers who are trying to make decisions. And so that's been one of the challenges, I think, for us as researchers in the kind of academic and community-based research world, is to think about how we collect data and information. And trying to conduct research during COVID is probably a whole nother panel and conversation. But I do think that in general, we have the other piece that I think is important to think about here is because of the histories of our community, we also know that some LGBTQ folks from early data were also more responsive to public health measures. We're more likely to engage in those practices. And so I think there's also this interesting piece where we might have some underlying conditions, but then also our better health promoting practices might cancel those things out. And so then it might look like we don't have an inequity, when in fact it's the burden on our own communities that we've taken on this work to try and rectify that. And so I think that's the piece often in terms of how much is this really being solved and supported and facilitated by a policy and a social and health system versus the important work that our community does and many other marginalized communities do to persist and survive through things like this.
Hey, I'm wondering if I saw your hand go up.
Always and forever. You should have seen my yes, we're better at processing public health messaging. We are doing that and we are great on that front. But just to cite some of the, so what we do know, I am not a researcher and we don't have great data on the impact of COVID in our communities, but we've established, going into pandemic, already health inequities, already past experiences of pandemics that I think it's fair to say our communities are still recovering from and being subjected to. But what we do know is that, 27%, and this is convenience survey data, so it's not like, don't post this up as a statistic that we know for sure all of the time. But we know that 27% of trans folks experienced interruptions to hormone medication. So that means that you're on hormones, and because of COVID-related issues, access to medication is delayed. Many folks were unable to get new prescriptions or referrals for hormones. We know that access to hormones has a significant positive impact on your mental health and well-being, overall sense of belonging, inclusion, happiness. And that denial or delayed care does have a significant impact. And then, as the world starts to open up, I'm already hearing, crisis calls from our trans health providers around an onslaught of new referrals. These are service providers that were already scrambling to manage wait lists that are ballooning beyond anything we can imagine, like literally doubling every year, with no capacity to address that gap in capacity. We also have, about 10% of trans folks going to access testing and care experience discrimination. If you think about that, during a public health crisis, when folks are trying to care for themselves, trying to care for their families and their loved ones, there is an added burden if walking into that testing clinic that you might not have a good experience. That it might be discriminatory. I have had folks in my life who've been dead named, so had the wrong name used to describe them, who've been questioned around their gender, like, oh, you're a man, oh, you're a woman. Experiences such as that mean that we're less likely to go back. And those also, pre-pandemic mean we're less likely to access in the first place. And so I think, one of my unfortunate things is we're already a year into a COVID response, and I don't think there's been a conversation around equity within our vaccination process, within our testing processes, resulting again in folks going in to get access to medically necessary care during a global pandemic and experiencing discrimination while doing so. In this country at this time, I would really hope that we're at a point where we should be able to guarantee an equitable experience to community members who are accessing essential health services. The fact that we couldn't, and it's literally as simple as putting up a sticker saying, tell me your pronouns. And we could have taken those steps in our COVID-19 testing, but we didn't across the board. Some, Ottawa Public Health has done some incredible work on this front. My own team worked with the Canadian Public Health Association to try to tackle this issue. But one of the big things is we actually could have been more equitable in our approach already. And that inequity does negatively impact trans and gender diverse folks' health, COVID recovery, and future well-being.
Great.
So that's my really depressing statistical overview of how bad the world is. Sorry.
Well, we need both, right? We need to understand what the problem is. And that gets back to Nathan's point around the fact that we actually don't have very good data. And just to, make that point a little bit more clearly around the census is that when we don't collect that kind of information in the census, that means that we can't link the census to other surveys that don't collect that data. So if we, I think I didn't make that very clear, but for things like race and ethnicity or immigration status, those are the kinds of things that we do collect in the census. And we can link those data to other surveys that don't have those outcomes or those variables. So, and that allows us to do much, much more analysis with much greater confidence than if we weren't able to link. So it really is a serious gap in terms of our capacity to do analysis with these populations. I want to go back to something that you raised, Faye, about when you mentioned mental health and the impact of, the lack of culturally safe services, for example, for trans and non-binary folks, and also for other folks in our LGBTQ2 plus communities. And that's the issue of, mental health. So we know that prior to COVID, our communities have reported worse mental health than the general population. Our rates of suicide are higher, and particularly for trans people. And we know that we're hearing more about this in the context of COVID. And I'd like to just highlight two sort of age populations here, and that's youth and seniors. And I'm wondering if any of you can talk a little bit about the impact of COVID-19 and the social distancing measures on youth and seniors. Genevieve.
Yeah, I'd love to jump in, Beth. Mental health is actually one of my niches, one of my interests that I really like to focus on. And frankly, it's because I don't think it gets talked about enough. And you've hit the nail on the head. When we talk about two LGBTQ communities, we can't help but talk about the disproportionate levels of mental health issues that are faced by folks within those communities. And that is even more so felt by youth and seniors, kind of the polarized ends of the spectrum in terms of age. And it's something that has been going since pre-pandemic. We've known this to be true. And it has gotten disproportionately worse during the pandemic. You factor in all of the things that that make for the perfect storm. We've been in isolation. A lot of people have lost their jobs. We've been living in very difficult economic times. We are at a place right now where a lot of youth, and in particular 2S LGBTQ youth who do kind of the more, who do end up disproportionately occupying kind of service jobs and frontline jobs, those jobs are not safe places to go anymore. So they aren't paying living wages, and now you're not having you're not in a healthy situation. You're at risk every time that you go to work. It's incredibly frustrating isn't the right word, but it can be so devastating to an individual's well-being. And when we think about the ways in which we can respond better to that, I look at youth and seniors, especially, or older adults, and as a community, or as a general rule of thumb, queer folks, 2S LGBTQ folks tend to rely on a very special sense of community. The definition of community within queer spaces is a very unique one. And it's one of the reasons that we all have chosen family, potentially as well as our biological families, but not always, right? And being isolated from our communities in the ways that we have been over the last, almost 2 years now, it goes without saying that that's going to have impacts. But then when you tack on top of that, all like pre-existing mental health issues, including high rates of suicide, it's a perfect storm. And it has been tragic. I can't tell you how many people I've encountered over the last 2 years, myself included, who have really struggled with mental health and being able to find the supports that we need. So not only are we not getting the medical support that we need, but we're not getting the mental health medical support that we need either. And that has made a very difficult time of the past year and a half, 2 years.
Can I just get you to expand a little bit, and I'll get you in a sec, Faye. I did see you. Just from your perspective as chair of the board of Capital Pride, one of the things that has been, I would say Pride is one of the core sort of cultural events for queer communities in Canada and around the world, and is often a place where people come to explore their sexualities and gender identities, to learn more about our communities. It's where people who are outside of our communities come to learn about our communities. And Pride has been substantially disrupted. So what do you think the impact is of that disruption on youth who are thinking, coming out perhaps, or older people who are coming out, because not everybody comes out young, and the impact on our community's cohesion or connection?
It's interesting because I think we would immediately go to the reaction that, well, because we haven't had the traditional Pride movement and the celebrations that come with that, then there must be this onslaught of people who have not been able to come out or access our services. But frankly, the reality has been that over the last 2 years, we've been forced to adapt, and we've been forced to change the ways in which we engage with communities, right? And this is not unique to Capital Pride. This is, across the board. But I have found that particularly in the 2S LGBTQ spaces in the National Capital Region, there has been this almost ease into kind of moving online and having resources that are available to wider audiences of folks. One of the biggest takeaways for Capital Pride from the pandemic is going to be this extra level of accessibility that we now have by having all of our online resources and platforms available to us, right? So we still have had a number of people reach out, and frankly, we've I don't even want to say doubled, it's been tripled, quadrupled the level of programming that we've offered because we saw the need. And I think this goes back to the point that Nathan was making, which is that we do spend a lot of that energy and do a lot of that work ourselves as a community. And it's something that we are quite good at. And whether it's a good thing or not that we are good at it is a whole other discussion for a different day. But I think that, at Capital Pride, we ran a couple of different educational series throughout the pandemic. And we ran a number of different virtual online events that folks attended from across the world. And so yes, while there is definitely on the ground a sense of loss of community because you don't interact in the same ways and the levels of connection are different, there has nonetheless been efforts to kind of pull folks into the community. We're not trying to push the agenda here, but pull folks who want to be a part of the community in and say, look, we're still here, arms open, from 6 feet apart with a mask, but we're here and we welcome you.
Faye, I know you wanted to jump in there, and as you do, I want us all to be thinking about the on the one hand, the expansion of access, the expansion of access to programs through online services, but also who is excluded from that, whether you're immigrant or refugee or Indigenous folks who live maybe more remotely or urban in urban settings, but don't have access to internet, people with low income in general. So how are we grappling with those sorts of exclusions at the same time as we're actually seeing a growth? So over to you, Faye, but meanwhile, let's think about that.
I love that. And I actually do, I think I echo Genevieve on that, like the potential of virtual care for our communities. Like we have, like urban centers are like the queer and trans hubs of our country. And we haven't really reconciled or recognized like homophobia and transphobia look different in rural spaces, are very much alive and well in ways that I think I, as a mostly urbanly raised person, couldn't recognize or fully understand. And that I think virtual care is an opportunity, but it's not the only or sole answer. But I want to come back. My one thought is just to keep in mind, like I had one kind of person in my head when I think of, queer and trans communities during COVID. And it really is that like 15-year-old kid who's just coming out and who isn't in a safe home. And that person hasn't been thought of through this pandemic by, I would say, most of our policymakers. Imagine being the gay kid who's stuck at home, or the trans kid who's stuck at home full time, whose parents are the only access to whatever community they may have, whatever physical spaces they may have. And imagine if those parents are not supportive, if they are homophobic or transphobic. Imagine that kid who has to spend years where their only outlet outside of their family is maybe their school. Maybe they're not safe to go to the GSA. Maybe they're not safe. They aren't able to access virtual spaces anonymously because they're worried about their parents seeing their data. That is the kid who, like, my heart goes out to throughout this pandemic, and who I think we haven't paid enough attention to. There's a whole generation of young queer and trans folks who are coming into themselves in probably homophobic and transphobic homes, and they don't have another option. They can't drop by the GSA without their parents knowing. And it's those kids more than any that I think policymakers and many of us have forgotten about. And I worry for those kids. But Beth, to your question, I think maybe I'll throw it to Nathan, because I just wanted to jump in with that one thought.
Yeah, thanks, Faye. Thanks, Beth. Thanks, Jean-Pierre. Yeah, I mean, just on the youth piece, I think another piece just to highlight is we know that our communities are overrepresented in underhoused and homeless populations. And that's a particular group also that, dealing with overdose epidemics, thinking about how we often think about COVID control protections as like stay at home. And what does that mean for someone who's doesn't have a home necessarily continuously? And to Faye's point around the safety within those homes. And then I think also in terms of this like electronic access piece, I think also is a key population to think about. And then I think a lot about, to the points around Pride. In 2018, we were at Pride festivals across Canada doing research in person. And one of the events we went to in Winnipeg was a Two-Spirit powwow. And there's cultural meaning to gathering in person, right? Sharing food, sharing music, sharing dance. And so I think I love what's happened and how innovative our communities have been, how innovative our artists have been to be able to like shift what they do into an online format. But at the same time, I think that we will always need that in person. And it provides a very different level of access and that I think is really critical for that piece. I think the other piece also is part of Pride is about its history and rebellion and revolt, and trans and queer folks of color who started that movement. And when we're online, perhaps similar to this panel, the people who come are the folks that have some level of interest and some level of willingness. And part of Pride is about taking up space and being seen, even by those who don't want to see us. And so I think that's the other value of really being in person as well. And to that point around visibility, it does make me really think about some of the elders in our community. When we've long heard stories about the need to go back into the closet to be able to receive good care in long-term care facilities and other kinds of settings. I think COVID in particular, thinking about who's allowed to come as a visitor, and what are the rules we use to determine those kinds of often very heteronormative kind of decision makings. And then also to my point earlier, the folks who are elders in our community are the ones who most directly lived through the HIV epidemic. And so that I think is another piece in terms of just thinking about how differentially affected it is as someone who is younger and has learned about that epidemic, as part of my, my learnings, but to have lived through that directly and now to be living through this directly as well, I think is another important piece to kind of highlight.
Yeah, I've been very mindful of the impact of COVID on seniors who may be living in long-term care facilities or other residential settings. As you mentioned, Nathan, a lot of concerns around sort of, again, the cultural safety in various settings. I know that work has been done to improve that in some areas, but nevertheless, I know that there is a lot of fear and concern about older LGBTQ people, facing the idea of going into residential care settings. And in the case of COVID, having maybe not having any of that sort of social or family support available to them, and maybe or not being out, right? So, just the level of isolation is really quite profound. And again, we don't have good data to really understand what the actual impact is. What we're making some very educated guesses here, and I think they would prove to be true. But we do get back to that, that challenge of not having systematically collected and analyzed data. Maybe I'll take this opportunity to pivot to our second question, seeing as we've gone a little bit over long on our first one. But I think we'll cover all the territory we need. And that is, what are the ways that we can undertake meaningful engagement, meaningful and ethical research and collaborative action to address inequities faced by 2S LGBTQIA+ populations? What does ethical, meaningful, and collaborative work look like? And I think this will be particularly, important and interesting for many of the audience members who are doing research and may be interested in collaborating on research with LGBTQ populations. But I'll throw this out. Are there sound approaches or particular considerations that all of us engaged in research or program delivery or policy development that should be taken into account when working with LGBTQ populations?
I'm happy to get us started on this. This feels like the bread and butter, the juicy, good conversation.
There you go.
I guess to start, I think one of the things around COVID in particular is to think about how much participating in research can be a privilege. I think back to some of the early kind of media coverage of folks in our community who had COVID, that wanted to participate in trials to provide their biological specimens to help research COVID cures, treatments, et cetera, that were banned because of existing policies in place around blood donation, which meant that during men who had sex with men, some trans women were ineligible to be able to participate in that research because of some of those extant policies. And so it's a piece that sometimes people are willing to do research and unable to do so. And I think that's a really good example of one of the ways that policy can impact our communities negatively. I think on the flip side, from a kind of access point, back to the conversation a little bit about online, is who's really able to take the time to participate in research studies, who's going to show up, especially now during COVID, to these research projects. And what are we doing as researchers to really increase that accessibility? Because if we're really fundamentally centering those who are most marginalized and focused on inequities, then we really need to make sure that our processes are going to be able to actually connect with those who are most marginalized. Otherwise, our research will always present a rosier picture than is probably true. And so that's been a constant struggle, but I think COVID in particular, when you think about during fatigue from being online, fatigue from just living and surviving through the pandemic, et cetera, that can be quite challenging. If I can speak more broadly, and I hope there's folks in the audience that don't do research with LGBTQ folks necessarily, what I would say to you is that we're in your studies. When we participate in your research, we don't just do queer research, we don't just do trans research, we care about lots of other things. So recognize that. Think about, Jordan, how are the experiences of our community within your research being seen, being measured? We might be an important confounder in your analysis. We might plays a mediating role in the relationship that you're trying to look at. But really, I encourage you to think about making us seen within all research doing that focuses on broad human populations, because we are there. And so it's nice for us as participants to be able to express who we are within the research and to make sure that you as researchers have that data that could really help inform some of the questions you're asking.
And Faye, sorry, I had a little trouble with my mute button there. Faye, from your perspective as a working in communities and working with and across communities, what would you like to add to what Nathan's saying about in terms of, sort of the engagement piece and culturally safe and appropriate and inclusive engagement?
I think I would echo everything that Nathan said. I think nothing about us without us is a philosophy that I hope many of us live by, and I would encourage you to reflect on if you don't know what that looks like in practice. I would also say reflect. So on one end, you can always ask about gender and sexuality in any kind of research in any context, and adding that question at the very least allows for a stronger analysis based off of homophobia, transphobia, and what those inequities might look like. I would also say meaningful research has to be more than just slapping a gay word or a rainbow onto a proposal or an ethics submission. I would love to see active engagement with both national and local community organizations. We have the Community-Based Research Center. We have Fierté Canada Pride. We have the Enchanté Network. We have local organizations like Kind Space, like Quadrangle, across this country who are ready to be engaged in research and who desperately want more research that speaks to our communities and our realities. Our communities simultaneously are like over-surveilled at the same time, and over-surveilled and over-surveyed, over-surveyed being the one that's more research-oriented in this context. And so partnering with our organizations demonstrates meaning and value for community members' time. By having Kind Space look it over and throw their logo and maybe be participating in that process, you build buy-in with community members and organizations. My other piece is that it's not enough to engage us when we don't have any actual power or influence or ability to change how findings are framed. A lot of research about trans folks is written by cis folks who have a lot of weird ideas about gender. And like all of us have weird ideas about gender, but queer and trans folks often have the ability to take a step back and look critically at gender and sexuality in our country, in our communities. And while the best and most well-intended researcher is examining their own bias, you always should try to engage communities directly with research. When my team does research, we have young folks, and we work a lot with young folks around mental health, engaged in co-creation. So what does this research look like? What are the questions we need to ask? What are the objectives? They also help design the outreach materials. They also help to analyze the survey data. They also help to write the final reports. And you can engage LGBTQ folks every step of the way in that process. But it also obligates you to make sure you're ready to not give them negative experiences. So that means both your researcher needs to probably have that LGBTQ 101 workshop, needs to not stumble over the word trans. And the research assistants, the admin folks, the entire team needs to have a baseline capacity to equitably serve LGBTQ people. And that, I think, is where meaning begins. But my last piece is turn it over to us. Go to CBRC, go to Enchanté, go to Kind Space and say, what are your research priorities? How can we support those? How can we help you? Research has to be a two-way exchange. We need to get something out of it if we're going to be interested in it. And you can demonstrate that value to us, again, by working with our local organizations.
I'm going to take a leap here and suggest that even where data are not, where I guess communities have not been consulted about the data collection, which actually also, is the case for probably most of our population level surveys, engagement can still be a very valuable piece of research and necessary. So I don't think what we're saying here is that if the research isn't always driven, or the data collection isn't always driven by queer communities, that it's not useful to us, because there are many systems like surveillance systems, like hospital administrative data, like surveys and so on, that are going to be collected in some sort of standardized way. They just are. And so, but better understanding how our communities want to use those data, how we would understand the limitations and the benefits of using those data, I think is really critically important. Because, when we talk about research, that's a world of different kinds of things, right? And so we don't necessarily want to suggest that data that are presently available are not useful. And at the same time, they are, each kind of data collection will have its own limitations. Geneviève, I want to jump in here because I know that data are and research are a very important part of the work that you do around human rights. And maybe you can talk a little bit about this question in that context. So talk about engagement, about data collection and research, about how that evidence is really important for moving forward on some of these issues.
Yeah, I mean, fundamentally, it's crucial when we're talking about kind of litigation and bringing challenges through the courts in order to ensure that the rights of 2S LGBTQ folks are respected, and that's kind of at a fundamental level. But if we push it even farther than that, it needs to form part of any kind of consultation process, frankly, for policy. It's been said, I can't remember who said it now, I think it was Faye who said, nothing for us without us. I mean, that is something that we say frequently in the community, right? And Nathan, I really liked your point about how, we have to recognize that participation itself is a privilege. And so from my end, I have definitely witnessed a lot of situations in which, well, we're going to consult with 2S LGBTQ communities, but really who we're consulting with within 2S LGBTQ communities is like a very select person. It often is the kind of upper middle class, white professional who is well-spoken and perhaps not as abreast of all issues within the 2S LGBT communities as they could be. And so I would really encourage folks to really remember that participation is a privilege. And when we talk about making sustainable change, we need to be talking to the folks who are in the trenches and the most marginalized, because there will never be less if we focus on, sorry, that came out very different in my head. When we center around the most marginalized identities, we are never going to go, oh, well, we needed to go in a different direction. Instead, that approach is more likely than not going to encompass every identity because we've focused on those most marginalized. When we focus on the less marginalized and we kind of sprinkle in a little bit of that queerness or any other marginalization, then you're still getting the results for the masses, as opposed to really digging in deep and seeing, well, what is it that every single member of our communities needs? And that's, I very much admire the work that Faye, that you do around, trans work and being the kind of the crux of anything that's being done. And it's so beneficial. So yeah, when we talk about how do we implement that research into kind of making policy changes, again, you just can't do it without focusing on who is the most marginalized here. And you have to do it in a way that isn't just, well, we're gonna say we spoke to Capital Pride, but really you just spoke to the chairperson of the board of directors, which, like, I don't encompass the experiences of everybody in the 2S LGBTQ community. I'm a very privileged person. I'm educated and I'm white and I am, like in the upper middle class of society. Like, I don't represent Monsieur, Madame, tout le monde who lives down the road and struggles with, struggles with a lot of things. So it's just something I think that frontline researchers or policymakers or experts need to consider that it's not just about those of us who are around this table, for example. It's about everybody else that isn't caught in that blanket or that net, I should say.
Well, it sounds like we're sort of coming back around to, the discussion of our acronym, almost like if that really sort of trying to establish the diversity within our communities. We are diverse across sexual orientations, across genders, across gender identities, across culturally specific sexual orientations and gender identities, even as those terms themselves are, highly Western and European. And so, and I think from the perspective of our efforts at inclusion, our efforts at reconciliation, being driven by basic principles of anti-oppression and, creating space for those of us who have resources to do so, creating space and supporting others who are working on the margins, I think is a really critical piece of this work. And as you mentioned, that will in itself create substantial change that benefits everyone. So I noticed that we have about 5 minutes left. And I'd like us to take a moment. We've talked a lot about problems and a lot about, which is good because we need to name them. But I also want us to leave on thinking about what we can do into the future. What do you want participants who are listening today to take from this discussion, and what would you like them to sort of bring into their work? Are there any particular suggestions or particularly useful interventions that you can think of that you'd like to share? And maybe I'll go around the circle. I think the last person to not speak was Nathan. So I'm going to start with you, Nathan.
Thanks, Beth. Yeah, I'm happy to start. I really have two things that I would say in terms of takeaways. The first is to acknowledge that 2S LGBTQ folks are a part of your community and likely a part of your research. So have you asked relevant questions? And that's not just about identity, but it's about our experiences and our realities. And the second piece would be that there's an amazing network, and Faye talked about this, of community agencies that serve our communities. Please connect with them. They bring value in so many ways. Acknowledge them in your work, join share power, ask how the relationship can be reciprocal.
Geneviève.
Yeah, thanks, Nathan. I completely agree with that. And I will add that, maybe ask yourself, have I made some assumptions here about the folks about whom I'm doing research or the policies that I'm drafting or whatever the case may be? Have I made assumptions? And if the answer is yes, then perhaps ask yourself, why haven't I gone and sought those answers directly from the community organizations that we've talked about and or individuals in the community that are going to be directly impacted by the outcome of your work. So I think that's where I believe it.
And Faye, almost last word to you.
Awesome. I would echo, I love panels where I get to go last because they said great things. My addition would be one to bring back to think about, problematize who your ideal survey filler, completer person is, who your ideal person that you're engaging in research with looks like. Problematize your impression of 2S LGBTQ people as all cisgender, white, middle-class gay men. Problematize your notion that community, even with their privilege, is somehow thriving in every way, because that's not the case. But challenge yourself to look deeper within our whole communities. And again, my frame of reference is street-involved 15-year-olds who crash on our couches because they aren't safe at shelters. That is what I want your point of reference to be. It's the poor trans folks who are homeless. It's the folks who are engaging in survival sex work. It's the folks who are doing whatever they can to keep themselves alive. So challenge yourself on that. And then don't necessarily default to everyone is included approach. Communities that have historically experienced inequity and injustice don't just need an equal slice of the pie. We need targeted responses that respond to our own histories, to our own inequities. We don't just need a homelessness strategy or a strategy to end homelessness. We also need one that recognizes the particular experience of homelessness within queer and trans communities. That it's not inclusive of everyone. It has to be targeted at different communities too. And I think I'll leave it at that. Thank you.
Well, I will actually reserve the last 30 seconds for myself just to so I try to sort of wrap this up in the context that we started, which was the impact of COVID-19 on our communities. And perhaps just remind folks, as if we don't already know, that COVID-19 is not over. This pandemic is not over. Much like HIV/AIDS is not over. We've had to learn to live with that. We've had to learn to live with risk, as Nathan discussed. But it's had a long-standing impact on our communities, and COVID will do the same. So there is opportunity to shift how we develop policies and programs related to COVID, how we think about human rights in our approach to access to healthcare, in how the social determinants of health interact to affect certain populations more deeply than others and create more systemic barriers. There is time for us to be thinking about these things as we're continuing to respond to COVID-19, but also with a lot of hope in my heart. I really hope that not only this discussion about LGBTQ2+ communities, but also racialized communities, immigrant communities, women, seniors, and a variety of disabled communities, a variety of communities who have been historically and systematically marginalized, how that COVID, in fact, has, because it has affected the whole world, has brought these inequities to light, has brought to light the social determinants of health and how crucial addressing these determinants are, and how important it is to build just and equitable societies for us all to thrive. I trust that we'll take this lesson of COVID with us and encourage all of us to keep in mind that and reach out to one another to share the wisdom we have about our communities, the resources that we have. And with that, I will thank Nathan Lachowski, Faye Johnstone, Genevieve Culverson, all of the support staff, the stage managers behind this effort. And we really appreciate the technical support. And thank you very much and have a great day.